Welcome, guys. Thanks for joining this Corona time. We're gonna share with you our complaint with this government, with this administration, which has not been handling this crisis of coronavirus and really missed the window to protect their citizens. So this is an interesting piece which is happening now. So it's broadcast live on YouTube. I want you guys to hear this. This is Secretary Azar. So let's get started.
If their doctor or public health physician believes they should be tested, it needs to always be clinically indicated to receive a test. So it's a false premise. Go to your doctor if you first, actually, don't go to your doctor. Call your doctor's office if you believe you may have the novel coronavirus. Call the clinic, call the hospital, call the doctor's office so that you don't just walk right in, follow their infection control procedures for doing that. And then,
Right there. Call in your doctor's office, follow the infection control procedures. Okay, this is the key point. Think about what happened in Seattle. Think about what happened in the senior center, in the Kirkland Senior Center. What happened exactly the opposite. There's no infection procedures. That's how the first responders were infected and went to quarantine. That's how those firefighters are exposed to the virus. That's how the situation in Kirkland Senior Center getting out of control become a hub of coronavirus, same as what happened in China, in Wuhan, China. And what should have really happened is by that time, before that happened, the government should already have the infectious procedures for this coronavirus in place, shared with the state and local officials and local institutions, especially those senior centers. Imagine when they get affected, when people are impacted, these people die. And this is a serious disease, not as people said, oh, it's like the flu, you will recover. How do you know? If it's not, if it's that not, if it's, if that's the fact, and why these congressmen need to be tested just because they have shared a room or shake hands or be in the same room with someone who is confirmed to have coronavirus. And this is the serious stuff. I think this is where the government have really missed the golden time, the golden window to help their people to be protected. And especially with the misinformation that's going around in the public, and people trust the president, and they vote the president Trump to represent their interest and protect their interest and protect American citizens in this crisis of coronavirus. What we have been seeing is China has locked down for almost the whole country to stop the spreading of this virus, because this virus is so serious and so severe. It happens so quickly, and all the people who get infected, if they don't get treated properly or in time, they will die. And so we have so much time to be prepared for this, but unfortunately, this still happens over here. So this is very sad to see, and I have been following this closely in the beginning, which I'm proud of what I have seen so far. I think as we have seen in Italy, they have to go through the lockdown. And I would imagine this will be something happening over here too pretty quickly. And ironically enough, we start seeing this, just came up in the news that National Guard is going to go into New York. So we're going to have military people coming to New York and lock down certain places within a certain range. I think it's about a mile or two in certain places when there is a cluster to prevent this from spreading. And we even have Los Angeles has the marathon happened over the 2 days ago on the Sunday, even though California has already been declared emergency. So clearly there is this mismanagement of this coronavirus crisis. So this is what I want to share with you guys. And if you pay attention to the news, I think a lot of things actually start happening about the government, about this task force. I followed Secretary Azar from the first day he shows up on the news. And I think he's a great guy, working really hard and very smart. And I trusted him he's going to do the right thing. But what it turns out to be is a fiasco of a shit show. And even now, the tested kits, as they said, they have millions, they have a couple millions. These are just numbers. They have no idea how many that's being available to the patients who want to be tested now, because they can say the testing kit is just sitting there. It's going to sit there if no one can be tested. And people getting such a running around and have to make different phone calls. Even the doctors goes on the TV and, saying that they have to talk to the Health and Human Services and so many times trying to get their patients tested. And what the outcome of this is, people get infected with coronavirus. And there are suspected cases, and doctors trying to get them tested because this is not being brought to the attention to the public, because this misinformation shared to the public by this administration. People are not taking very seriously. So when the symptoms start to show up, they don't quarantine themselves. They still go about their normal life with spreading the virus to a lot of other people without even knowing. And by the time they start go to the hospital and being seen by the doctors, there's no procedure in place. So the doctors, all the people in the hospital are exposed to the virus. And then when they need to be tested, they cannot be tested. So their time waiting to be tested are the crucial times that they need to be treated in the hospital, but they cannot. And they can be hospitalized until it becomes very serious. They have to be hospitalized, and then they will agree to give a test. But by that time, chances are these people are severely damaged by this coronavirus, because the experience shown from the other people that's infected or going through the ordeal in China is that the first couple of days, when there is no symptoms, the first 5 days, the virus is replicating itself like crazy in your body. It starts damaging your lung and making damages to your lung already. That's how you start feeling it's getting severe. And they start seeing a doctor. But remember, during that time, you're actually shedding the virus to the crowd, to all the people you have contact with. No matter if it's in the metro bus, on the T, on the bus, on your commute to work, and all your co-workers in your office space. So it's pretty bad. And on top of that, when you start going to the hospitals, if you cannot be confirmed quickly, you will lose your important time to be treated, to fight this virus, right? And once you get hospitalized, and that's what they documented with a lot of other cases in China, is that your liver is starting to be injured or damaged already. That's around about 10 days. And the next thing you see happen is what they call symptom storms, if I was translating the terms properly. And then which means the next important organ of a kidney is going to be damaged, and then it basically just stopped working. And your immune system trying to kill the virus in the meantime damage your own liver and damage your own kidney, and you just collapse and die. So this is how serious this thing is. I think the government is really misleading the people. We have an administration who is led by our president, who cares more about the number and the re-election over the impact of the virus to the society, to people, and to the economy. So we're having an